Hi, my name is Cameron. I'm going to be your student nurse today. Would you state your full name and date of birth for me, please?
Flores, August 3rd, 1974.
Okay, so let's just check your wristband, make sure that everything is accurate here. Okay, and do you have any known allergies?
Not that I know of.
Okay, we do have NKA written down here on your file too. So before I begin, I'm going to visually inspect, make sure that your appearance and behavior is well, making sure that you have no ongoing therapy such as an IV, a Foley catheter, PEG tube, none of that sort, which you don't, so perfect. So before we begin, are you in any pain today?
No, I'm not.
Okay, and we're just also going to assess your mental and status and orientation. So with that, I'm going to ask you a few questions. You just answer them to the best of your ability. So do you know who the President of the United States is currently?
Yes, Joe Biden.
Okay, and do you know what year we're in?
2021.
All right, and do you know what you were here for today?
I'm here for a checkup.
Okay, so what we're going to do during checkup is a full head-to-toe assessment, which is going to take about 20 to 30 minutes. And basically, we are just checking to make sure that everything sounds good, looks good, feels right, like make sure that you are in good condition. So before we begin, I'm going to go ahead and perform medical asepsis by washing my hands and donning my gloves. Okay. And are you comfortable with the setting? Do you want any more privacy or change of location?
No, I'm okay.
Okay, so we will have the door shut and curtain pulled. So I'm pulling the curtain. Okay. Alright, so when we begin, we are going to start with the head and the face. So right now, I'm just going to inspect visually the size, shape, symmetrical of the scalp, the skull, make sure that the skin looks good, there's no lesions, no discoloration. So if you don't mind, I would like to inspect the hair. If you don't mind, I put my hands touch.
That's fine.
Okay. So we're just gonna feel through the hair and the scalp, making sure that there's no discoloration, lesions, making sure that the hair is evenly distributed. We're checking for moisture, and everything does look good. So now we're gonna go ahead and move on to the face. So we're going to be feeling the texture of the skin, the moisture, temperature, and then we would feel for the frontal sinus and the maxillary sinus. And if you feel any pain, please let me know. Okay, any tenderness?
No.
All right, so we're gonna go ahead and test cranial nerve number 7. So this is gonna be testing your facial nerve. So if you would you please wrinkle your forehead for me? Okay, and then clench your eyes very tightly. All right, and then give a good smile and puff your cheeks. Very good. So next we are going to go ahead and move on to the eyes. So for the eyes, we're going to be inspecting visually the eyebrows, the eyelids, eyelashes, and the conjunctiva, which is going to be right here where I gently pull down your eyelids. And while I'm here, I'm also going to be looking at the sclera, which is the whites of the eye. Everything looks good, so we're going to go ahead and continue, and we're going to palpate right here along the eyebrows. Any discomfort?
No.
Okay, so we're going to palpate the eyelids next. Okay, and then right here along the lacrimal ducts. Is there any tenderness or discomfort?
No.
Okay, so everything does look good. The hair is evenly distributed along the eyebrows, the eyelashes. There's no missing spots. There's no discoloration of the eyelids or anything. Everything looks normal. So now we are going to test cranial nerve number 2, which is the optic nerve. It's going to test your near vision. So I'm going to give you this paper right here, and you're just going to read this top line for me.
Photo release for use of photography.
Very good. So next we're going to test the cranial nerves number 3, 4, and 6 for the 6 cardinal fields of gaze. I'm going to take my pen light right here, and we're just going to move it into 6 different positions, and you're only going to follow it with your eyes, okay? Okay, very good. So next I'm going to check for the pupil reaction. I'm going to check for constriction in your eyes when I flash the pen light. You're going to look straight ahead and I'm just going to come from the side. You won't look directly into the light at all. Okay? Very good. So we did get constriction in both pupils at the same time during both. So next we would move on and we would go to the ears. So for the ears, we are just going to inspect the external and internal auditory canal. And we're looking for any discoloration, lesions, anything that is abnormal. And then we're going to palpate along the auricles of the ear and the tragus. Okay, and then we'll do the same over here. We would palpate along the auricles of the ear. Any discomfort?
No.
Okay, and then we'll palpate with the tragus as well. And then next we're going to be looking again along the external and internal of the ear. And we're going to inspect with the pen light to look for any discharge or lesions on the inside, which there's none. So we'll go ahead and check this other ear with the pen light as well for any discharge or lesions. And everything does look good. So next we're going to go ahead and test the acoustic nerve, which is going to be cranial nerve number 8. I'm going to stand behind you and I'm going to rub my fingers together and you're going to raise a hand whenever you hear something. Good. Okay. So next we would move on to the nose. And for the nose, I'm just going to inspect visually, make sure everything looks symmetrical and aligned, and I'm going to go ahead and start to palpate along the bridge and the septum for position and alignment. I'm making sure that everything is symmetrical on each side of the nose. Is there any tenderness?
No.
Okay. So next we're going to test the patency of the nares. If you don't mind, would you close one nostril for me and breathe through the opposite? Okay, and the same with the other nostril. Okay, that sounds good. So now we're going to go ahead and inspect on the inside with the pen light. You can close your eyes. Okay, I see no discharge, no lesions, or anything abnormal on the inside. Okay, so next we would move to the mouth and the throat. So for the mouth, I'm going to just inspect the inside all around, and I'm going to take a tongue depressor, and I'm going to have you open your mouth and say ah. So stick your tongue out for me. Right here, this is just testing the vagus nerve for symmetrical lift of the uvula when you say ah. Okay, and while I'm here, I'm also checking the teeth. I'm checking the inside of the mouth for any lesions, any discoloration inside the mouth, the tongue. And can you lift your tongue up for me? Okay, and then twist it to one side and the other. Very good. Everything does look normal on the inside. And then, now, if you could protrude your tongue outwards, you're going to stick your tongue out. And you're going to move it side to side. Very good. Okay. So next, I'm going to feel right here on your trach. And you'll just swallow for me. Okay, very good. So we did get an up and downward motion. Let's just make sure that everything is aligned there. So next I'm going to feel the carotid pulses. Okay, and then I'll come up here and feel your temporal pulses. And now I'm going to feel for the lymph nodes along the side of your face and neck. Okay, so now I'm going to listen to those carotid pulses with the bell side of my stethoscope. Very good. And now we're going to test the spinal accessory. We're going to test the muscle strength right here in your shoulders. So I'm going to go ahead and stand behind you. I'll place my hands right here on your shoulders, and you're gonna shrug against resistance. Ready? Go ahead and shrug. Very good. And so while I'm here, actually, I'm gonna go ahead and continue with the spinal accessory, and I'm just checking for the alignment of the spine and the placement of the scapulas. Okay, everything does look good. So while we're here next, I am going to go ahead and move on to the upper extremities. So for upper extremities, we're gonna go over here. We're palpating and inspecting visually the color of the skin. We're looking at the hair distribution. We're making sure that everything is nice and aligned. There is no masses. We have no discoloration. Is there any tenderness?
No.
Okay, so we're gonna go through all the way to the wrists and the hands, fingers. We're looking at all parts for any other visible lesions, discoloration, or abnormalities. Then we're going to test for skin turgor. So I'm just gonna gently pinch and make sure that the skin bounces back. This is testing the elasticity of the skin. So next we'll move on to the fingernails. So right here I'm gonna press on the beds of your nail for a capillary refill. We're just looking for blood return. So it should go from white back to pink because that's where we're getting our color return. I'm gonna do that on each fingernail. Very good. And then we'll come over here and do the same thing. We're going to inspect and palpate. We're checking the temperature, moisture. We're making sure everything is aligned. Any tenderness?
No.
Okay, and we have no discoloration. Okay, so we're gonna check down the wrist, the fingers, hand. We're gonna check skin turgor on this side as well. Gently pinch, and we do have it bounce back, so that shows the elasticity. And then we're gonna check for capillary refill in the nail beds again. So we are getting blood return. And then we're going to check for the brachial pulse and the radial pulse. Okay. And then we'll go over here and check the brachial pulse and the radial pulse. Okay, and so we're going to go ahead and test the range of motion, and also muscle strength. So first you can go ahead and grip my hands. Okay, and then for range of motion, you're just gonna go ahead and do flexion and extension. So you're gonna go ahead and put one arm up, and we're gonna put it back down. And then you'll raise the other arm up and put it back down as well. Is there any pain or discomfort during that?
No.
Okay. So that completes the upper extremities, and we're gonna move on to the anterior chest. So I'm just going to inspect visually, make sure that we have no lesions, discoloration, and we're gonna palpate, make sure that there's no tenderness, no masses, we're not seeing anything or feeling anything out of the ordinary, no discomfort or tenderness.
No.
Okay, so now I'm gonna go ahead and osculate for one respiratory cycle to listen to your lungs. And while I'm doing this, I'm gonna be looking at the rise and fall of your chest. Okay, so just go ahead and start taking some deep breaths for me. Okay. Everything does sound good, and the rise and fall is very normal. There's nothing abnormal about your breaths. So next we would go ahead and we're gonna listen to the heart sounds. We're gonna move on to listening to the heart sounds, which is gonna be 4 places in the chest. So I'm gonna go ahead and start there, and you can go ahead and just relax. everything does sound good with the heart sounds as well. And then next, if I had another person with me, we would be looking for the post deficit by measuring two different places at once, and we would compare our numbers and subtract to get the deficit. So next we'll go ahead and move on to the anterior chest, and I'm going to be right here behind you. And back here, we are going to be listening to lung sun scan as well, and I'll be listening to one full respiratory cycle, and then, yeah, okay. If you could go ahead and take some deep breaths for me again. Okay, so everything does sound good here again. So just checking for spinal alignment again. Everything does seem good. Scapula placement and the texture, temperature, no tenderness back here.
No.
Okay, so everything does look good on the anterior chest as well. So next we will go ahead and move on to the abdomen. So for the abdomen, it's going to be mid-chest to pubis. And I'm going to be listening to the vowel sounds of your right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. Okay. Okay, and then we would palpate the same regions, these same quadrants, for any discomfort, tenderness, if any. And then we would also palpate the bladder. If you feel any tenderness, pain, discomfort anytime, please let me know. And then we would palpate the bladder right here. And then we would also palpate the inguinal region for femoral pulses and the lymph nodes. Okay, so we're just gonna verbalize that though for right now. And then now that completes the abdomen portion. So we're going to move on to the lower extremities. Okay, so if I could see this leg. So right here we are inspecting visually and palpating to make sure that we don't see any visible lesions, any discoloration. We're looking for evenly distribution of the hair, if any, and we are feeling for any masses, anything that causes discomfort or tenderness and alignment. And we're gonna go all the way down through the ankle and the foot, and then we're gonna look for capillary refill again in the toenails as well. So this is just looking for blood return again. We're gonna do it in each toe. Okay. And then we do the same thing to this leg. So we're looking visually and palpating, and we're looking at the color of the skin, the shape, symmetry of the other leg. We're looking at the alignment. We're checking temperature and moisture. And we're looking for any tenderness, anything abnormal, anything that doesn't feel good or that's causing pain or discomfort, all the way along through the ankle and the pain. I said ankle and pain, I meant ankle and foot. And we're also checking the capillary refill and the toes again. So we're looking for blood return. Okay. And now we're going to look for the popliteal pulse, which is right here behind the knee. And we're just going to palpate that. And then same thing down here for the dorsalis pedis pulse, right here on top of the foot. And then our posterior tibial pulse is right here on the inside, inner ankle, right underneath that little part of bone. Okay, and then we will move on to the other side. And same thing, popliteal pulse right here behind the knee. And down here is the dorsalis pedis. And again, we would do the tibial posterior, which is right here underneath that area. Okay. Now I'm going to have you stick your foot out. We're going to do some range of motion. If you stick out your foot, you're going to point your toes upward and then point them downward. And then same thing for the other foot, you'll point them upward and downward. Okay. Next, I will do some resistance against your leg, and you're just going to push up your leg against my hand. Okay, go ahead. Okay, and the other leg. Good. Okay, so next, that completes the lower extremity. So next, if you would, could you stand up for me, please? We're going to do the remaining. Okay. So if you could just walk towards me and then away from me, we're going to be assessing your balance and gait here. Okay? Good. Okay, and then if you'll come stand right here, we're going to do the Romberg test. So if you'll put your arms across your shoulders, and then we're just making sure that you're able to do this and that you're capable. And so now, if you will close your eyes, I will watch you and make sure that your balance, coordination, and everything is good. Okay, and we would do this for about 30 seconds, but for video purposes, you're okay. You can open your eyes again. Now, if you would, you're going to close your eyes and have your arms outward, and then you're going to alternate index fingers touching the tip of your nose with your eyes closed rapidly. Okay, you can go ahead. Very good. Okay, you can have a seat again. All right, so that does complete our head to toe assessment. Do you have any further questions for me?
No, I do not.
Okay, do you have anything else that you need from me? Do you need to use the restroom? Would you like a drink of water?
No, I'm good.
Okay, so then that completes our head to toe assessment. Your call light will be right here by your bed, and I'm going to go ahead and perform medical asepsis by removing my gloves and washing my hands. Okay. If you need me, just call me. Thank you, Mrs. Flores.
Thank you.